Well, a brand new poll out today on where Americans stand on health care reform from Scott Rasmussen. Rasmussen reports they find that a majority of Americans oppose health care reform as we're looking at it now by a margin of 54 to 42%. Again today, a small group of lawmakers and members of the White House administration will be working on what may become the final version of health care reform in this country, and they'll be doing it behind closed doors. Not exactly what the president, when he was a candidate, promised when he was on the campaign trail back in Chester, Virginia. Take a listen.
I'm going to have all the negotiations around the big table. We'll have doctors and nurses and hospital administrators, insurance companies, drug companies. They'll get a seat at the table. They just won't be able to buy every chair. But what we will do is we'll have the negotiations televised on C-SPAN so that people can see who is making arguments on behalf of their constituents and who are making arguments on behalf of the drug companies or the insurance companies.
Let's talk about the president's promise of transparency now. Pete Seek, former White House spokesperson under President George W. Bush. Richard Goodstein is here as well with us, former President Bill Clinton campaign advisor. Richard, first to you. I know the Republicans have been raising a lot of questions about transparency, but reporters have too. And Robert Gibbs at the White House, the spokesperson, was just asked about that exact quote, in fact, and said, "I do think the administration has been transparent." What happened to the televised negotiations?
Well, you'll remember that President Obama was asked this question at a press conference in the East Wing not long ago, and he pointed to the fact that when he did have the doctors and nurses and hospitals and so forth at a public meeting at the White House, the C-SPAN was there. Now, the fact of the matter is the end game, where you've got your handful of representatives of the White House, of the House and the Senate, they are traveling a kind of well-trod path that certainly the Bush administration used about prescription drugs, about their tax cuts. And you saw on the Fox Sunday show yesterday, Ken Conrad was asked a question. He said, "Look, I'm not going to negotiate in public." And I think that's not an unusual thing. So maybe on the campaign trail, the president kind of overstated things a little bit, but I bet if you would even ask him back then, would he have wanted where we are now, with, again, a handful of senators and congressmen and White House staff, have that televised on C-SPAN? No, I don't think that would be a good way to generate public policy.
Pete, your thoughts?
Well, I think this is one of the very few times that Richard and I will agree on an issue. And that is, during the campaign, especially the Obama team was very overzealous in some things when it came to process. We will close Guantanamo Bay in a year. Well, it turns out it's not going to happen. With health care, since they've been in office, we're going to have a bill by the end of August, and then by the end of September, and then by Thanksgiving. Now it's by Christmas. So when it comes to process, they tend to be they jump the gun a little bit on these issues. And I think they did this in terms of transparency when this goes. But, it's one thing to not have these meetings completely open to C-SPAN, but it's another thing to only have Democrats in these meetings. No Republicans have been in these meetings. It's just been Democrats writing these bills. And, if they're going to have closed-door meetings, fine, but at least have both sides at that big table.
Pete, I want to stay with you for a second. The president obviously has been trying to sell this plan. When we look at these poll numbers, we're talking about 54% opposed to what's been on the table so far. Are his efforts paying off?
I don't think so. I mean, the Obama health care plan is a lot like that balloon floating around Colorado last week. No one's on board, and the folks that are hiding in a box in the attic. And that's just, the fact of the matter here. Just a little pop culture reference for you. But really, I mean, you look at the poll numbers, and they really haven't shifted all that much. President Obama has been out on TV a lot. He's been trumpeting his plan a lot. But the poll numbers are staying the same, which is the inherent difficulties in passing the ambitious plan that he's trying to do. People are worried about the cost. They're worried about a government role in health care. And yes, they want to see reform, but not that kind of reform.
Yeah, interesting, Richard. In this same Rasmussen Reports poll, just real quickly, I only have about 20 seconds, 61% say it is important to get reform. It's this reform they say they don't like.
Yeah, I don't think that we all know what this reform is. And the fact is, if it was that offensive, Bob Dole, Howard Baker, Bill Frist, Tommy Thompson, the head of the HHS under President Bush, they wouldn't be clamoring for health care reform themselves. Not this bill, because there isn't a this bill quite yet, but we see what the kind of likely components are likely to be, and it will provide the public what they do want, which is universal coverage as much as possible, bringing costs down, ending these insurance reforms around pre-existing conditions and so forth. So I do think there's general acceptance around that, not just Democrats, but people like Dole and Frist and so forth as well, which does suggest that there actually might be something bipartisan about it, God forbid.
Well, maybe that's part of the problem, though, that there isn't just one plan out there. There's a lot of confusion, and that is reflected in the polls as well. We got to leave it there, Richard. Pete, good to see you both.
Sure, Jane.